Welcome to our presentation on the Community Food Bank of New Jersey's nutrition policy. This presentation will take you through what a nutrition policy means for us as a food bank, why it matters to our mission, and the specific goals we've set to ensure its success. We believe this policy is a crucial step forward in our commitment to improving the health and well-being of the individuals and families we serve. Let's learn together how our new nutrition policy will make a meaningful impact. Let's get started. The first question you may have is, what exactly is a nutrition policy? A nutrition policy is a formal written tool to ensure clear communication with our stakeholders, who are our partners, neighbors, and staff, about the food bank's intentions and decision-making around our food sourcing and distribution. A nutrition policy guides CFBNJ to provide food that supports individual and community health. Why did CFBNJ need a nutrition policy? We know that our diet has a profound impact on overall health. According to the USDA, poor nutrition is the leading cause of illness in the United States. A nutrition policy creates a guide for our organization to promote sourcing and distributing more nutrient-dense options. A healthier inventory helps us to address important issues like diet-related disease risk, our neighbors' food preferences, and increased risk of chronic disease associated with food insecurity. We'll go over each of these in more detail now. First, let's discuss the risk of diet-related disease. According to the USDA, diet-related diseases are responsible for 600,000 deaths annually. Conditions such as obesity, cardiovascular disease, hypertension, and type 2 diabetes are among the preventable diet-related illnesses. Excessive sodium intake and low consumption of fruits and vegetables and whole grains are the main concerns associated with diet-related disease. Implementing a nutrition policy helps us to support better access to nutritious foods and empowers our neighbors to make the best dietary choices for their individual needs. Studies have shown that our neighbors want healthier food options at food pantries. A 2017 study from the CDC reports that 93% of pantries participants wanted more fruits and vegetables available for their families. In addition, when asked what products were most important, participants cited meat, poultry, fish, fresh fruits and vegetables, and dairy as some of the main products. The same study also shared that neighbors rely consistently on food pantries as a substantial source of their household food. Just over half of the survey respondents reported that they received half or more of their total food from a food pantry. A nutrition policy helps us respond to our community's preferences and supply more of the food that they want to see in their pantries. Diet-related chronic diseases disproportionately impact historically underserved populations and hit hardest in communities with high food insecurity. According to the USDA, 10 chronic diseases were found to be associated with food insecurity. And the more severe a person's food insecurity becomes, the more likely that person is to develop a chronic condition. The CDC also highlights that Black households experience food insecurity at more than 3 times the rate of white households. And when we look at healthcare costs, 85% of healthcare spending is related to diet-related chronic disease. This data demonstrates the importance that nutrition plays in our lives and the lives of our neighbors for the communities that we serve. Here we have some further data linking food insecurity and chronic disease. According to the USDA, very low food insecurity is associated with a 15.3 percentage point increase in developing any chronic condition. As you can see in the charts to the right, hypertension and coronary heart disease are some diseases where risk increases gradually as food insecurity becomes more severe. We just learned about why a nutrition policy is important. Having a nutrition policy in place is key to promoting healthy choices among our neighbors and reducing the risk of chronic health conditions. Now let's dive into an overview of our policy. The policy consists of 6 sections. These sections are the rationale and benefits, HER nutrition guidelines, foods to prioritize, foods to deprioritize, inventory goals, and culturally responsive principles. We will go over each section in more detail through the rest of the presentation. Beyond nutrition and health impacts, a nutrition policy has benefits to our organization as well. The policy serves as a commitment to CFBNJ's partners, neighbors, and staff to distribute food that protects and supports individual and community health. It also helps in planning and prioritizing strategic goals for the inventory. It assists in aligning sourcing and distributing decisions with the policy's goals. The policy provides an institutional memory about our commitment to meet our nutrition goals through any changes of management or staff. In addition, it helps communicate with our donors on our intentions about the types of foods that we will prioritize. And lastly, the policy will aid CFBNJ to understand and respond to our community's nutrition needs. Next, we'll review the Healthy Eating Research Guidelines for a Charitable Food System, or HER for short. These guidelines were developed in 2019 when the Healthy Eating Research convened a panel of experts in the charitable food system, nutrition, and food policy fields to create clear, specific recommendations for evidence-based nutrition guidelines tailored to the unique needs and capacity of the charitable food system. The ranking system first divides the products into 11 categories. These categories include fruits and vegetables, grain, protein, dairy, non-dairy alternatives, beverages, mixed dishes, processed and packaged snacks, desserts, condiments, and cooking staples. These products are then ranked into 3 tiers depending on the amounts of saturated fats, sodium, and added sugar. The expert panel chose to focus primarily on these 3 nutrients to limit based on the evidence linked in increased consumption to the increased risk for diet-related chronic disease. The tiers are choose often, choose sometimes, and choose rarely. The specific thresholds for each category and nutrient are based on a single serving. Identifying a product's tier is easy to do using the chart on the right that details the nutrient thresholds for each food category. There are some items that we do not rank. Cooking supplies, condiments, and baby food are not given HER rankings, and some items are given an assorted not ranked label. This is for products that arrive to us in large pallets of miscellaneous items. Due to the potential variety of items, it is too difficult to rank them. Next, we'll take a closer look at the specific foods we'll prioritize under our nutrition policy. Our focus will be on increasing the procurement of items that will fall within the choose often and choose sometimes tiers of the HER guidelines. CFBNJ will prioritize fruits and vegetables by focusing on a variety of fresh, frozen, and canned products with no added sugar, low sodium, and 100% fruit juices. Protein-rich foods including dried and canned beans, no sugar-added nut butters, unsalted nuts, fresh and frozen poultry, lean beef, lean pork, fresh and frozen low-sodium canned fish, eggs, and tofu. We will also prioritize whole grains with 100% whole grain as the main ingredient and cereals with low amounts of added sugar. Low-fat dairy and non-dairy alternatives like unsweetened yogurts, skim, 1% and 2% milks, and plant-based milks. And lastly, low-sodium mixed dishes including but not limited to soups, stews, and frozen meals. In the next section of the policy, we will address the foods that we will deprioritize. It is important to emphasize that we are not banning any foods entirely. We firmly believe that all foods can be a part of a balanced diet. To enhance the overall health of those we serve, optimize CFBNJ's resources, and align with food preferences, CFBNJ will deprioritize certain items and food categories. This means that we will avoid directly purchasing or seeking donations of these items. These items include desserts, including but not limited to baked goods, ice cream, frozen novelty desserts, fruit snacks, and candy. Sugar-sweetened beverages, which include regular soda, fruit drinks that are not 100% juice, sports drinks, energy drinks, sweetened waters, and coffee and tea beverages containing added sugars. We will also deprioritize mechanically separated meats, as feedback from our network partners indicates that this item is not favorable among our neighbors. And lastly, any food items ranking as choose rarely to align with the current dietary guidelines that recommend limiting the intake of saturated fat, sodium, and added sugars. Let's take a look at our inventory goals. First, 95% of all purchased foods will be made up of the choose often and choose sometimes category items. We aim to reach this goal by June of 2027. We will also focus on our efforts on expanding the variety of fresh produce available to our network. And we're implementing best practices to incorporate more culturally relevant and familiar foods to our neighbors. To uphold our commitment to culturally responsive foods, we will take several specific actions. Strive for inclusivity and equity. We are dedicated to removing barriers and ensuring access to nutritious and culturally appropriate foods for individuals from all backgrounds. Engage with the community. We will actively seek to understand the unique needs and preferences and challenges related to nutrition within the community. Input from our network partners and neighbors will guide the development and enhancement of our services and food offerings. Provide interpretation and translation services. When available, we will offer interpretation and translation services to facilitate effective communication and support. Thank you for taking the time to learn about CFBNJ's nutrition policy. If you have any questions or need additional information, please do not hesitate to get in touch. Erin Long, our Community Nutrition Manager, is available to assist you. You can reach Erin via email at elong@cfbnj.org.